Now, most people have probably heard about diabetes and likely know someone who has it. But what most of us don't realize is that prediabetes is a serious condition that affects 1 in 3 adults in the U.S. New Hampshire State epidemiologist Dr. Ben Chan joins us now. Good afternoon to you, doctor.
Good afternoon.
Let's just start by telling us exactly what prediabetes is.
Yeah, that's a good question. So both prediabetes and diabetes are a condition where a person develops a higher than normal blood sugar level. When we consume food, our bodies digest the food and absorb the sugar in the food into our bloodstream so that our cells and tissues in the body can use that sugar as energy. In order to do that, in order for the cells to take up blood sugar, a hormone called insulin is required, which is naturally produced in the body in an organ called the pancreas. So diabetes and prediabetes are diseases where a person either, one, doesn't produce enough insulin, or two, their bodies have become resistant to insulin and can't use insulin correctly. This is normally a process that develops progressively over time as a person's body develops this resistance to the body's insulin, which is mainly driven by obesity, by the way. The body tries to produce more and more insulin and it can't keep up, and so somebody's blood sugar then begins to rise. So prediabetes is this transition zone between somebody that has a normal blood sugar and when they go on to develop overt diabetes level blood sugars.
Okay, so what are some risk factors when it comes to prediabetes and type 2 diabetes?
Yes, and type 2 diabetes is sort of the process that I was mainly describing before. Prediabetes, as the name implies, is one of the major risk factors for going on to develop overt diabetes. The two main modifiable risk factors, though, for both prediabetes and diabetes are obesity and physical inactivity. Diabetes and prediabetes themselves also are risk factors for other serious health complications such as heart disease, stroke, kidney failure, blindness, leg amputations.
And how many people have prediabetes?
So the CDC has estimated that about 1 in 3, or actually more than 1 in 3 adults in the United States have prediabetes. The majority don't know it. And so for this reason, it's important for people to maintain routine healthcare checkups, for clinicians to regularly check blood sugar levels as an early warning sign against development of diabetes or prediabetes.
Can we prevent it?
Yeah, so the main focus of prevention is lifestyle modification. This includes diet, exercise, weight loss. In fact, weight loss has been shown to be as effective, if not more effective, than starting a medication to control blood sugar. And so weight loss is the mainstay of therapy for preventing or delaying the onset of diabetes. There are national programs available, like the National Diabetes Prevention Program led by the CDC, which provides trained lifestyle coaches to help people in this regard. So we encourage people to talk to their healthcare providers about resources. They can also visit the website diabetespreventionnh.org to look for resources in their area.
Dr. Benjamin Chan, thank you so much for being with us. Always nice to have you. Thanks for the information.
Thank you.
We'll be right back.